let's talk a little bit about how to keep yourself protected. There are sometimes people who will bill insurance for services not rendered. Patients don't always know about that or know what to look for, so how can we protect ourselves?
So that's a great question. One of the things that you want to remain vigilant with is protecting your member identification number. You almost want to look at it like it's your social security number, a credit card number, or even a bank card number, because once a fraudster or a scammer obtains that number, they can bill an insurance company for services not rendered. A lot of times they'll do what I call, telehealth scams, where they'll reach out and basically state, if you give me your identification number, we can get you a free back brace, knee brace. There was actually a recent break, a criminal investigation into Medicare, where they had a scheme. It was over $100 million that was billed out for unnecessary back and knee braces. One of the things I want to stress the importance of is reviewing your explanation of benefits. It's entirely important to take a look, because we have found in instances that providers will tack on additional charges or they'll bill for a service that wasn't rendered. The most important thing that you want to focus on is the date of service. You want to make sure that you check that to ensure that you were at a provider's office on that particular date of service.
How does this hurt the patient who may not know, they may not be being billed for anything, they're still getting the services they need, they have no idea as long as they're healthy?
So believe it or not, health insurance fraud is not a victimless crime. We are actually the victims at the end of the day. Fraud will contribute to increased premiums. The recent estimate that I read with regards to how much it's costing us on a yearly basis for healthcare fraud is roughly $80 billion. So again, you may not care, I only had to pay a copay, how is this affecting me? Well, it's coming out of our taxes, it's coming out of our paychecks.
So in the age of COVID-19, are you seeing more opportunities, sadly, for people to take advantage of others? And if so, what are they? How do we protect ourselves?
And we're seeing all types of different things. For instance, there was an article released last week, two gentlemen from New York. They had put out false claims that they were able to kill COVID with their air freshener. So, we see things like that. Basically, anything advertising a cure is fake. You want to stay away from those types of things. There is no cure at this time. We've heard the CDC, the Center for Disease Control, they are knocking, going door to door. That's absolutely not true. If somebody comes to your door and offers you any type of COVID service, call law enforcement immediately, just to be safe. Because again, anybody soliciting at your door with free kits or any type of service, it is a red flag, and law enforcement should be notified.
So there's nobody who's coming that would present identification that looks legitimate?
It could be, but all of the things that we've seen in special investigations, it's not legitimate.
So can you talk a little bit about what Horizon is doing to get a handle on and prevent healthcare fraud?
Of course. One of the things that we pride ourselves on is our collaboration with state and federal law enforcement. We have cooperative agreements with agencies such as the FBI, the Office of Inspector General. We deal with state agencies, the Office of the Insurance Fraud Prosecutor. So we work directly with them, especially in strong instances of fraud, where we will make that referral to law enforcement to help us to move forward. I mean, we look at every allegation, no matter how large or small it is, because you just never know. Some of our cases that we've handled actually have started with the smallest referrals.
Trust that gut and pick up the phone, and if it's nothing, no harm in calling and saying, hey, is this right?
Absolutely. Just remain vigilant. And like I said, trust your gut feeling. That's what I do. I always trust it. You're usually on the right path.